Hello, my name is Elise Harris, and I am a triple breast cancer survivor. And I'm here to share with you my experience as a breast cancer survivor and to provide or try to supply information that I have learned on my journey. Today's topic will be what to do when you find out that you have breast cancer. For me, in my journey, which began um, Friday, May 12th, 2002, I found the lump in my breast. I went to the oncology doctor and I was tested, and I found out that I did have breast cancer. And I had my family members with me. There were some questions that some of my family members had asked. And one of the questions that was asked, what type of breast cancer was it? Did the cancer spread to other parts of my body? Will there be chemotherapy involved? Is there family history involved? Which for me, there's a strong case of breast cancer. My mother died of breast cancer when she was 47 years old. My grandmother died when she was 44 of breast cancer. And I was 36 when I was diagnosed with breast cancer. And also, too, you need to find out what is your breast tissue type. One of the most one of the many breast cancer types that there are is the triple negative breast cancer. And what is triple negative breast cancer? It is estrogen receptor negative, ER, as some would call, progesterone receptor negative, which is PR negative, and HER2 negative. What is triple negative breast cancer? About 15 to 20% of breast cancers in the United States are triple negative breast cancer survivors. Anyone can get triple negative breast cancers, but it seems to occur more in women, younger women, black women, people will have a BRCA gene. They also may be more common among Hispanic women compared to white women. People with triple negative breast cancer at age 60 or younger, and everyone diagnosed with metastatic triple negative breast cancer are recommended for genetic testing. Triple negative breast cancer and a risk of recurrence. Triple negative breast cancer is often fast growing. They are more likely estrogen receptor positive. Breast cancers to recur at least within the first 5 years of diagnosis. This is slide one here, which shows the stats and all relevant information regarding the triple negative breast cancer. After the 5 year difference, the rate begins to decrease. Slide two, please. These are also risk factors also determined to help determining breast cancer. Triple negative breast cancer options. Triple negative breast cancer is usually a treatment with a combination of surgery with or without radiation or chemotherapy. Chemotherapy works well with people with triple negative breast cancer. These cancers tend to respond better to chemotherapy than some other types of breast cancer. Some people with early triple negative breast cancer survivor has cancer remaining in their breasts after chemotherapy given before surgery. The chemotherapy may lower the risk of reoccurrence and improve survival. I personally had chemotherapy twice, and the triple negative breast cancer survivor is treated with HRT because because it's estrogen receptor. The triple negative breast cancer also is treated with HER2 targeted therapies such as trastuzumab, Herceptin, because it is HER2 negative. Treatment options for metastatic triple negative breast cancer. Metastatic triple negative breast cancer is treated with chemotherapy and other drugs. Chemotherapy, platinum-based chemotherapy drugs such as carboplatin, cisplatin, and options for those with triple negative or with the BRCA1 or the BRCA2 inherited gene. Immunotherapy is drugs that helps the body immune system attack the cancer cells. Checkpoint inhibitors are the most common type of immune therapy. They take the brakes off natural forces that limit the immune system can control rumor cells. Also, there are clinical trials also too to test the safety and the benefits of the new treatments. They also test combinations of new standard treatments and also too when you've been diagnosed with breast cancer, my personal experience has been is to take someone with you because you're not going to be able to remember anything that the doctors are telling you. Also, write down any relevant questions that you may have. Again, what type of questions that you should have, what type of cancer it is, what stage is it, will it require surgery, is there chemotherapy involved? You also need to find out what is your breast tissue, and also too, depending, discuss it among your family members. Do you feel like a second opinion is required? Have your family members or your really close friends go with you with the appointments, again, because you're not going to be able to remember everything what the doctor is telling you. My experience, I went to the Henry Ford Hospital System, and the doctors that I met there and the nurses, I had a pleasurable experience considering all three times and the outcome. And also too, the doctors that I've met, they were very sympathetic, got down to any questions that I have, but overall, my experience that I had with the Henry Ford Health System um, was the overall experience was a good experience, and I would recommend them. I am not a medical professional. I am a breast cancer survivor here to share my experience, and also one of the couple of the slides. One of them is from Susan G. Komen, and also from Merit Oncology, which is the second slide. I am not a Merit oncology spokesperson. I'm not getting paid for that. Again, this is just my experience as a breast cancer survivor. May God bless you.